All right, today we're diving into a really clever bit of molecular sabotage. We're talking about a drug you've probably heard of, allopurinol, and it's a huge deal in preventing some conditions that are, frankly, unbelievably painful. So let's break down exactly how this little saboteur gets the job done.
So, let's start with the pain. If you've ever had a gout attack, or know someone who has, you know it's no joke. It's sudden, it's intense, it's excruciating. But what is actually going on inside your body to cause that level of agony?
The answer sounds like something out of a horror story. It's not just some chemical reaction. It's the physical formation of microscopic, needle-like crystals. Yeah, tiny little daggers made of uric acid, literally growing inside your joints. They are the culprits causing massive inflammation and, you guessed it, a world of pain. But where do they even come from?
Well, those nasty crystals are really just a symptom. They're the end result of a much bigger issue. The real root problem is an overload of a substance called uric acid floating around in your blood. Let's dig into that.
So, uric acid is actually a totally normal waste product. Your body makes it when it breaks down things called purines. Now, purines are everywhere. They're in our own cells, and they're in a lot of foods we eat, like red meat or certain kinds of seafood. Usually, this is no big deal. Your body just gets rid of it. But when the levels get too high, that's a condition called hyperuricemia, your body can't keep up, and that's when the trouble begins.
Okay, so if the problem is making too much uric acid, the obvious solution is to, well, stop making so much of it. And this is where allopurinol comes in, and trust me, its strategy is fascinating. It doesn't just put a Band-Aid on the problem, it goes right to the source and cleverly shuts down the entire production line.
I want you to think of your body's uric acid production process like a factory. The raw materials coming in are the purines. The final product going out the door is uric acid. And the most important piece of machinery on that assembly line, the machine that does the final critical step, is an enzyme called xanthine oxidase. Remember that name? It's the key to everything.
So, how does allopurinol shut that machine down? It uses a tactic that has a pretty dramatic name. It's a suicide inhibitor, and honestly, that's the perfect description. The target, our enzyme, xanthine oxidase, is tricked into grabbing the drug and using it to build the very thing that will destroy it. The enzyme literally helps create the weapon of its own destruction. How cool is that?
So here's how the con works. On the left, you see the natural stuff the enzyme is supposed to be working on. On the right, you have allopurinol and its active partner in crime, oxypurinol. See how similar they look? They're molecular mimics. The enzyme gets fooled, grabs them by mistake, and bam, the machine gets jammed. They are the perfect decoys to shut the entire factory down.
So who needs this clever little saboteur in their corner? Well, its mission is way bigger than just managing gout. It actually plays a life-saving role in some really serious medical situations.
Of course, its day job, its main gig, is the long-term prevention of gout. And let me be clear, this is not a painkiller you take when you're having an attack. It's a preventative medicine you take every day to stop attacks from ever happening, to shrink those nasty crystal deposits called tophi, and to keep you from forming painful uric acid kidney stones.
But this is where allopurinol goes from being a helpful drug to an absolutely critical one. In cancer therapy, when chemotherapy works really well, it kills a huge number of cancer cells all at once. The problem is all those dying cells dump a massive flood of purines into the bloodstream. This can cause a sudden, life-threatening spike in uric acid that can shut down the kidneys. Allopurinol is given before chemo to prevent this dangerous complication, which is known as tumor lysis syndrome. It's literally a lifesaver.
Okay, so like any powerful tool, allopurinol comes with a user manual. You absolutely have to know the rules to use it safely, and that means getting the dose right and being aware of the risks.
If you remember one single thing about taking allopurinol, please let it be this mantra: start low, go slow. This is the golden rule, and for a very good reason. If you start with too high of a dose, you can cause uric acid levels to plummet too quickly, and paradoxically, that sudden change can shake loose the crystals that are already in your joints and trigger the exact gout attack you're trying to prevent. So low and slow is the only way to go.
So what's the goal here? The treatment is all about hitting a target number. For most people, doctors want to get the uric acid level in your blood below 6 milligrams per deciliter. They'll start with a low dose and slowly increase it over weeks or months, checking your blood levels until you hit that magic number. That's how you know it's working.
Now we have to talk about side effects. It's usually tolerated really well, but it is absolutely vital that you know what to watch for. On the left, you've got the more common, usually mild stuff, a little rash, some nausea, but the stuff on the right is a different story. Any sign of a severe skin reaction, like blistering, or if you get a fever and feel sick, you need to seek medical help immediately. That includes a very rare but incredibly serious condition called allopurinol hypersensitivity syndrome. Don't ignore these signs. Beyond those side effects, there are a few critical warnings and drug interactions that you absolutely, positively must know about. These are non-negotiable.
Okay, I need everyone to listen closely to this one. This is one of the most dangerous, well-known interactions in all of pharmacy. It's between allopurinol and two specific immunosuppressant drugs, azathioprine and 6-mercaptopurine.
So why is this combo so incredibly dangerous? Well, remember our factory machine, the xanthine oxidase enzyme that allopurinol blocks? It turns out that same enzyme is responsible for breaking down azathioprine and 6-MP. So when you block it with allopurinol, the levels of these other powerful drugs can skyrocket to toxic levels, potentially causing your bone marrow to shut down. It can be fatal.
And look at this number. To manage this, we're not talking about a small tweak. If a patient has to be on both, the dose of the immunosuppressant has to be slashed, often by as much as 75%. That's a massive reduction, and it's absolutely necessary to prevent a catastrophic outcome.
And it's not just those two. Allopurinol can also boost the effects of the blood thinner warfarin, which increases bleeding risk. It can make you more likely to get a skin rash if you're also taking antibiotics like amoxicillin. And it can have complex interactions with certain blood pressure pills, the thiazide diuretics. So your doctor and pharmacist need to know everything you're taking.
Whew, okay, we have covered a lot of ground here, from molecular decoys to life-threatening interactions. So let's wrap up by boiling it all down to the key clinical pearls, the absolute must-know takeaways.
Here are the 4 big things to lock into your brain. 1, this is for prevention. It is not a painkiller for an attack that's already happening. 2, to prevent those early flare-ups, doctors often prescribe an anti-inflammatory to take alongside it for the first few months. 3, hydration is your friend. Drinking plenty of water helps your kidneys do their job. And 4, this is not a temporary fix. For most people, it's a lifelong commitment. If you stop taking it, that uric acid factory fires right back up. So, when you really think about it, allopurinol isn't just a pill you pop for a week. It's a fundamental intervention in your body's chemistry. It's a long-term, often lifelong strategy for managing a chronic disease. And that requires consistency, awareness, and a real partnership with your healthcare team. So the final question is, are you prepared for that commitment?